Okay. Hi, I'm Denise from Louisiana.
And I'm Carl Adams, her husband.
And I had Lyme disease for 16 years before I came to Sponaugle Wellness. The reason that I came was because obviously I had Lyme disease, chronic Lyme. I had chronic mono. I also had babesiosis. And right before I came, I had a spell of about 13 and a half months where I had 5 different surgeries. I had also developed cataracts and glaucoma, and my vision was at 2,000. Yeah, that's 2,000. And my contact prescription was about a minus 16 and a half.
She didn't even know what I looked like anymore.
No, I didn't. My daughter, as a matter of fact, said, "Mom, all I really want is for you to be able to look me in the eyes again." Say something.
And how long were you sick? I mean, what year? When Lyme disease started? It's been a long time.
I started with Lyme disease in 2000. And when I got here, it was 2016. And I had told Carl, I said, you know, after going through all these surgeries in such a short period of time, I said, something is going on. Either my Lyme disease is reactivated or there's something else. I don't know. And we heard about Dennis from Louisiana, who had went from basically being comatose to running 5 miles a day in just, you know, from November to April. And so I told my husband, I said, that's it. I'm calling to talk to somebody, which I did, and spoke to a patient coordinator who said, you're in luck. We have a webinar tonight. Listen to the webinar and call me back in the morning and let me know what you think. So I did that, and I told my husband, I didn't even ask. I said, I'm going.
She was on the way with or without me.
Right.
But before then, I mean, we went to a lot of doctors.
We did.
I mean, just with the Lyme disease, I mean, I don't know how many, 10, 12 just with Lyme disease between, I don't know, infectious, rheumatologists,
dermatologist, family doctor, internalist, and I was seeing another Lyme literate doctor, but no comparison to what Doc does. You know, he had me on vitamins and supplements and ran tests and did blood work and that sort of thing, but there was no intravenous intervention. Absolutely no biofilm treatment. I didn't even know what biofilm was when I got here.
And the eyesight? I mean, how many doctors did the eyesight?
The eyesight, I saw 10 doctors. And
surgery?
Yes, I had 2 glaucoma surgeries. One was in both eyes where it was a laser, and then the second one was where they actually put a shunt in my eye to make sure that the pressure would go down. And none of them were able to figure out what Doc did in, it seemed like seconds, really. None of them were able to figure out that it was mold.
Well, but at the beginning, I was at the beginning of the eye issue, you know, it was contact. So we went to one of the doctors, which is a very good doctor, eye doctor, and he tried 25 pairs of hard lens contacts. 25 pairs over what, a year and a half?
Right, and that was after I had gone through all the soft lenses.
All the surgeries, all the soft lenses. It was just, it's never going to end.
Right.
And that's when we knew we had to do something different. I mean, the regular stuff was just not working for us.
Right.
So that's when we, of course, like she said, we came here. So I just have to say, you know, when we got here and we had a consultation with Doc, right? So he starts talking about, we're here for Lyme disease, and right. I know that all the other people, and of course we went to some we listened to some webinars, we got online, every video I could watch on Facebook, whatever, you know, I watched for all these patients who got better, okay? So I'm like, is this going to happen for us? So I know her hopes and dreams were pinned on that. So I didn't want her to be disappointed. So anyway, yeah. so I had to give you that to tell you this next story. So, or what happened, actually, now story. But so we're in the room, we're talking with Doc. He has all this all these tests that he ran. I mean, just things we never heard of before. So he talked a little bit about Lyme disease, but not a lot. He starts talking about mold and, you know, biofilm and this and that, and I'm like, dude, we're here for Lyme disease. I don't know what all this other stuff is, but we're here for Lyme disease, and we better get to the Lyme disease pretty fast. Okay? So with that being said, but, you know, I went with it because, you know, I'm here, right? Nobody else has answers, so I got to listen. With that being said, so we listened, and we, like good little patients, we did what we should do. And within 4 days of detoxing, we actually, after 4 days, we went out from the hotel we were staying in. And when we got outside, in the truck, started going down the road, she started crying. And I'm like, what's wrong? She says, I can see. She says, I can see. As I can see this, I can see this guy in the car. He's bald-headed. That wasn't me. That was another guy. So he's bald-headed. I can see him. I can see there's 2 people in this car, and she's looking at street signs and things she hadn't done in a long time. And I'm like, okay, I just need to shut up and I need to listen. And that's what that's what I've done, is listen to Doc and go through the program and follow it. And I mean, we're sitting here today, so.
I mean, I had accepted that I was going blind. We had already started making plans of going on various trips, you know, short trips here and there. Well, I could still see. And none of the doctors that I had seen were able to figure out that it was mold, and that, you know, the mold had caused the cataract issue because it caused, as Doc says, something to melt and form cataracts. And then my retina and brain were not communicating, so my visual cortex was only operating at 13%, in addition to the cataracts and the glaucoma. So you put all that together, and I couldn't even see the sign on the Walmart building. Carl was so gracious. When we went anywhere, he was on my arm, and he would have to tell me, step up, step down. And I know it aggravated him sometimes.
Yeah, he caused me to drink a little more than I drink.
But,
or drink a lot.
You know, I mean, it was necessary, because I would literally look for the pavement to have a different color if there was a step up or step down, and that's how I knew. But if it was colored different and there was no step up or step down, I was like a horse trying to, you know, figure out, okay, do I need to step up, or is it going down? What's the situation here?
So what was your vision before, when we got here? What was the vision?
When I got here, my vision was 22,000.
And what is it today?
Today it is 2020.
Yay.
I can see everything.
And I don't have to drink as much.
It's wonderful. I mean, I had a brand new grandbaby, and I would not change her diaper, her poo-poo diapers, because I was afraid that she would not be clean, and that, you know, she would potentially get a diaper rash because grandma didn't do a good job. Well, now I can change all the poo-poo diapers I want.
Papa's not changing no diapers.
And
what happened?
I can see her eyelashes, and I can actually walk her because, you know, I can see now. I was night blind as well. And if you were to take off the lights in here, the light from the windows wouldn't have even been enough for me to see. We remodeled our house. We had lights installed throughout the house, just so I could have enough light to sort of see around the house, which is still nice because we are getting older. Kind of need a little bit more light.
The alternative sucks. You gotta get older.
Yeah, the
alternative's not good.
Exactly. So, you know, over a 16-year period, you spend quite a bit of money. I was flying back and forth to the doctor because I am from South Louisiana, so there are no Lyme literate doctors there. Of course, you know, vitamin supplements, my copays, so on and so forth. At one point, it was $1,200 a month out of pocket. I can't say it was that, you know, toward the end, because I was getting somewhat better with the Lyme. I assume that at some point, probably around the eye thing, is when the mold came into play in conjunction with the Lyme. And
Doc was the only one to figure that out. I mean, he really was. I mean, I don't know where we would be, what our life would be like right now. I really don't. I mean, I could tell by having a conversation now that our eyesight is what it is. talking to our doctor back home, our doctor, and he admitted that he was pretty much at the end of what he knew.
Yeah.
He was at the end. He didn't know what to do anymore. He just knew he had to keep trying. So at some point it would have been just, give up is all that would have happened, and she just went blind.
Right.
So that was the reality of it. So anyway, so all those things passed, but that's passed. So now, how you doing now?
Well, now 2020. Before coming to Dr. Sponaugle, when I woke up in the morning, all of my joints hurt. I was nauseous all day, pretty much. Always had a headache, which a lot of the times turned into a migraine. I was exhausted. Even when I woke up in the morning, I was exhausted. My quality of life wasn't how much time do I have. My quality of life was, do I have enough energy to do that? Basically, we had agreed my primary job at that point was just to work, go to work and
come home and
come
rest.
home, and that was it.
So she'd be able to go to work again the next day.
Right.
Just rest, work, rest, work. That was objective. Not having fun, not having a life, just to be able to go to work, come home, rest,
right,
and be able to go to work again.
So now I wake up in the morning and I'm up and nothing hurts. I'm not exhausted. I do get tired like normal people, but I have not been exhausted in months.
Yeah.
Over a year, I have not been exhausted. We can do whatever we want to do. Now it's back to my quality of life is, what do I have time to do? So I can honestly say that the only regret I have is that I didn't come here sooner.
Yeah.
Wow.
So if anybody's out there and you don't know what you have, or somebody can't figure it out, I can tell you Doc's going to get you the answers.
Right.
He's going to figure it out. Now you have to do your part. We all have to do our part. She have to do hers. It's
right.
hard. It's a hard process to go through. Make no mistake about it. It's not easy, but it's well worth it.
Yes, it is.
Yeah.
I would refinance my home all over again to come here.
Yeah. And everyone is great. Staff, Doc, everyone. We're blessed to have been here and be able to be, and come back every now and again. And we're welcome.
Right.
Yep.
Thank you.
Thank you for sharing your story, Denise and Carl. Thank you.